going to take this opportunity to officially declare this media briefing open. Good morning, Honorable Minister, Deputy Minister, members of the panel, fellow South African members of the media. My name is Foster Mohale. I'm going to be the facilitator of this media briefing. I'm responsible for media relations in the National Department of Health, compliments of the new season. I believe everybody had a restful, peaceful, and joyous festive period. So without wasting any time, I'm going to hand over to the Honorable Minister, Dr. Joe Patla, to give us the opening address. Over to you, Honorable Minister.
Thank you very much, Foster, and good morning to Deputy Minister, Dr. Lomo, DG, Dr. Crisp as well, and all officials from the Health Department. Our panelists, Dr. Wasila Jassat and Dr. Michelle Groom, NICD, Professor Glenda Gray, President of South African Medical Research Council, Professor Linda Gale Becker, all the media, viewers, listeners, and good morning to all South Africans. I hope many of us were able to have some rest and enjoyed a peaceful and safe reunion with family and friends during the festive season, and that those who went on holiday managed to have a good break. But certainly, as it is always the case during this festive season, many of our citizens lose their lives, and this was the case also this time with a lot of road crashes. Very tragic indeed. We just had yesterday a very tragic accident on the N1 towards my province where more than 17 people perished in one crash. We pass our condolences to all the bereaved families. Exactly 4 weeks ago, on the 17th of December 2021, was the last time we spoke to the nation. At that time, the fourth wave was engulfing the whole country, rising steeply in 8 provinces, while showing signs of decline in the Gauteng province where it had started, and also indicating that it had reached its peak in Gauteng. Our biggest fear at the time was the inevitable movement of people in mass transportation, in buses, in taxis and trains, and also social gatherings that could fuel super spreading events all over the country. The trends over the following weeks all over the country followed that of Gauteng. We indeed saw steep rises of infections on a daily basis with high positivity rates of between 25 and 30%, and even above that on a daily basis. Fortunately, the pattern of highly reduced severity as borne out by low hospitalization rates, including less use of oxygen as a therapy, and less high use of high care and ICU also continued in the other provinces. We did say at the time that we're hoping that what we're seeing in Gauteng with less severity while the numbers were rising would continue. And indeed, fortunately, that pattern continued in the other 8 provinces. Even more encouraging was that the fatality rates also continued to decline, even though it's still regrettable that we lost hundreds of our citizens during the course of the last 4 weeks. As the Omicron variant has been spreading to various parts of the world, the pattern seems to be the same. Our panelists were just discussing that earlier before we started, with less severity compared to previous variants. With the variant now, the Omicron variant, having been identified in 149 countries, as on the 6th of January, identified by the WHO, as compared to 76 countries when we last spoke on the 17th of December 2021. Notwithstanding the reduced severity overall, the Omicron variant is still very deadly, especially for people of advanced age and also people with comorbidities, and as we will see later on, also for the unvaccinated. In South Africa, in the first week of 2022, we have seen a 13.9, almost 14% reduction in the number of new cases. In this first week of January, there were 46,680 cases compared to the last week of 2021, where we had 54,191 new cases. In the past week, the Western Cape had the highest number of new cases, followed by KwaZulu-Natal and then Gauteng. All other provinces accounted for only 11% of new cases. There has been a 4.8, almost a 5% reduction in reported deaths over the last 7 days. As of yesterday, the 13th of January, there has been a 27% reduction in new cases compared to 7 days before on a national scale, and the reduction was in all provinces in terms of new cases. There has been a 6.3% reduction in hospitalization compared to 7 days earlier, even though 3 provinces, that is in Mpumalanga, Northern Cape and Western Cape, did report some small increases in the admissions. The national recovery rate, also very encouraging, now stands at 94%, and current active cases as of yesterday, 106,883, which is a 22.7% reduction of active cases compared to 24 hours earlier. The positivity rate of tests has gone down from the highest, as I've mentioned, in the middle of December of 25 to 30%. Also in the last week of December. Currently, as we reporting of yesterday, this has gone down to 14%, which is still high. We want to get down to less than 5%, which will indicate stability. Hospital admissions were rising in the middle of December when we gave our last update, but have been declining steadily. Overall admissions to hospitals over this 4th wave has been much lower than the previous 3 waves. We did indicate this trend and it has continued. Thus, the term which our medical scientists have coined of decoupling between the steep rise in infections, which is not accompanied by similar rise in hospitalizations and ICU and deaths. Similar pattern has been observed in relation to fatalities. Gauteng province has officially exited the 4th wave in terms of the technical definition of a wave. Gauteng, we can now say officially that Gauteng has technically exited the 4th wave this week. And all other provinces have reached their peaks. All 8 provinces have reached their peaks and are now on a decline. Of note is the fact that the decline in new infections is not a steep decline as was the incline. So this virus rises steeply, but when it goes down slowly, but at least it's going down, and this is encouraging. We must emphasize that the 4th wave is showing unequivocally the protection of vaccination against severe illness and death. We are today unveiling an additional tool on the dashboard of our reporting, in addition to our daily reporting, which shows very clearly the correlation between those who are unvaccinated amongst the hospital admissions as compared to those who are vaccinated, including those in high care in ICU. And an elaborate presentation on this will be done by Ms. Melanie Volmarans later on. Our vaccination program has struggled over the festive season. As we reported on the 17th of December, all provinces took steps to improve access with mobile and pop-up sites at places such as toll gates, roadblocks, and shopping malls, and even at the beach fronts of Durban. The uptake of these opportunities were not as big as we had hoped, as people focused on their festivities and their leisure. After a near total lull between Christmas and New Year, the vaccination rate has picked up slightly, but it's still below 100,000 doses per day, which is not good enough. So we hope that we can be able to push it higher. As of close of business last night, 28.7 million doses of vaccines had been administered to a total of 18.4 million adult individuals, which translates to 45.5% of all adults above age of 18 having received at least 1 jab. Those who are fully vaccinated stood at just under 16 million at 15.9 million, which constitute 40% of our adult population. The leading province in terms of vaccine coverage is currently the Free State province. Congratulations to them. at 54.1%, followed by the Western Cape at 53.6%, Limpopo at 52.2%, and the Eastern Cape at 50%. Those are the 4 provinces which have passed the 50% coverage of the adult population with at least 1 jab. 3 provinces are next, with the Northern Cape at 47%, the Northwest 44%, and Gauteng 42.7%. At the bottom of the ladder, it's Mpumalanga at 39.5% and KwaZulu-Natal at 39%. Last night, Gauteng crossed the 8 million doses administered, which is a significant milestone. The challenge for the Gauteng province is just that they're dealing with a very huge population. Almost 1/4 of South Africans are found in Gauteng. So despite administering 8 million doses, that has only covered 42.7% of the adult population, but a very good performance. As we are aware, vaccination has opened for minors between the ages of 12 and 17. And in this group, just over 1 million doses have been administered. Already 73,000 have already received their second dose, as after administering only 1 dose. 2 doses were subsequently approved by the regulator on the basis of new information that the severity of adverse effects was really, the myocarditis was found not to be a major factor as initially reported. We have done very well with the over 60s, 60+ cohort, with just under 67% vaccinated, with some districts in the country actually surpassing 75% of the over 60s. The 50 to 59 stands at 62.3%, and the 35 to 49 stand at 50%. The lowest coverage is our biggest cohort, which is the 18 to 34 years of age, which is still at 31.6%. As you know, we have also opened up for boosters for the general population following the Sisonke 2 boosters for health workers. And these boosters have now been opened for the general adult population, with Pfizer 3rd dose being available after 6 months of your 2nd dose, and the J&J 2nd dose being available after 2 months of your 1 dose of a J&J vaccine. So this is now available. People just have to check their last dates of the 2nd dose of Pfizer and the 1 dose of J&J. 6 months for the one, that is the Pfizer, and 2 months for the J&J. Then you can present yourself, even if you have not received a message, to your nearest vaccination point. You'll get your booster. Our main priority then nevertheless remained the full vaccination of all adults, at least up to 70% coverage. I wish to reiterate that the protection of vaccines against severe illness is uncontested, as we can see with the 4th wave, and also as we saw the protection of health workers and educators in the 3rd wave. Thanks to our collaboration with the private sector and the Solidarity Fund, we have sufficient capacity to provide vaccinations to all adult South African citizens. They just need to present themselves and they will get their jab. We will unveil plans to provide more opportunities for vaccination in the next few weeks, and also increase our communication campaign to try to convince more South Africans about the benefits of vaccination. The issue of vaccine mandates is also under discussion, and further announcements will be made by government at the appropriate time. Again, I wish to thank and appreciate the sterling work done by all our health workers under difficult circumstances, including the high load of trauma casualties during the festive season. Let us do our best as citizens to protect our health workers by vaccinating, by also observing health safety measures, but also by not drinking and driving. I wish to conclude by saying that to all South Africans, that 2022 can indeed be a better year. It's all in our hand. We have seen that while we cannot predict the future trajectory of the COVID-19 virus and its variants, but learning from the way we have been able to deal with the 4th wave and the protection of vaccines, the future does look brighter if we all do our best, that is to be vaccinated. We can get we can get back more of our lives, social life. More people can get to work. More businesses can be able to operate at full capacity. We can get more of our sporting, our recreation, and all our entertainment back. But the door to enter that normal life is vaccination. And again, I want to urge all those who have not yet vaccinated to come forward and receive their jabs. Thank you very much.
Thanks very much, Honorable Minister, for that message as far as the vaccination is concerned. There's a saying that when one door closes, another one opens, and we should not allow the next door of a fifth wave to open so soon. We can prevent that by taking vaccine and complying with the COVID-19 protocols. So on that note, without wasting any time, I'm going to call upon Dr. Michelle Groom from NICD to give us the update as far as the epidemiological report is concerned. So without wasting any time, I'm going to hand over to Dr. Michelle. Over to you, Doc.
Thanks. Good morning, Honourable Minister, DGs, colleagues and members of the media. So just a quick update in terms of the global situation, and you can see that Omicron, although was initially detected in Southern Africa, has rapidly spread across the world, with many countries, almost 150 now, detecting Omicron. And as you can see, some of these are really just in countries that are not conducting sequencing. So I think this variant in particular has spread really rapidly. And I think just in terms of the global numbers, you can see compared even to the previous kind of global waves, how there's been this tremendous increase in the number of cases, particularly driven by increases in Europe and the US. But I think just to note that this is also just based in terms of, as we know, case numbers are always based in terms of the number of tests that are done, and I think extensive increases in testing as well, which may be accounting for those numbers. So in South Africa, we've similarly seen just how Omicron has now dominated all of our sequences. This was the Beta variant that decreased, was then the Delta, and you can see now just almost 99% of our sequences that are now are caused by Omicron. And so you can really see how rapidly this variant has overtaken from the others, with very, very low proportions of the other variants detected at the moment. In terms of the global, in terms of South African number of cases, just over 3.5 million. And obviously these are the laboratory confirmed cases, and we know are an underestimation of the true number of infections in South Africa. We reached our peak in terms of the 7-day moving average in mid-December. And as the minister mentioned, we saw this very rapid increase in case numbers and a little bit of a slower downslope in terms of the decreases. But I think really saw a little bit of a dip in terms of that Christmas week, where case numbers were a little bit lower, saw a little bit of an increase over the last 2 weeks, but persistent decreases in terms of the 7-day moving average. Just in terms of the provinces, the third wave had a lot of diversity in terms of the way the provinces presented in the third wave, a little bit more consistent this time with this rapid increase in all of the provinces, followed by a decrease, although still slight differences in the timing. And so you can see Gauteng was the first province to start, the first province to reach their peak, and has now exited the fourth wave. Slight increase you can see in leveling off in most of the provinces this week, with Gauteng showing a tiny increase, 2%. So I think it's more just in relation to slightly increasing testing following the Christmas period, and now starting to see those persistent decreases in case numbers this week. In terms of age, I think also we know there was a lot of concern at the beginning of the fourth wave in terms of the increases in numbers of COVID in children, but you can see really that in the under 10-year-olds, the incidence has remained the lowest out of all the age groups. And so while in the under 5, slightly higher than what we've seen in previous waves, still low incidence. I think just to note that the increased incidence compared to other waves in the 20 to 39-year-olds. So you can see that was higher. Whereas we've seen this kind of decrease in terms of the overall incidence across the waves in the elderly, and also just reflective in terms of this is the age group which has the best vaccine coverage at this stage. And similarly for your 40 to 59-year-olds, you can see there's this decreasing trend in incidence. So I think just showing how important we need to increase our vaccine coverage in those younger age groups as well. As the minister mentioned, Gauteng has officially exited the fourth wave according to the wave metrics that we've been using for previous waves. In terms of testing, a slight increase in testing this past week, I think just as people have headed home, but persistent decreases in the percent testing positive. And so you can once again see this rapid rise and percent testing positive actually reaching the highest level that we've seen during this pandemic, but a sustained decrease. There was a 6.5% decrease from the last week of 2021 to the first week of 2022. And it's down to yesterday, we had a positivity rate of just over 14%. So consistent decreases there. And you can see in all the provinces over the past 2 weeks that we have had decreases in the percent positivity. And you can really just see the spread over the last month, from the northern parts of the country down to, where the coastal provinces were relatively spared. Then we had these periods when there was high positivity everywhere. And now, where Gauteng and the northern eastern parts have now returned to lower positivity rates, followed by the other provinces. I just wanted to show, this is the percent testing positive, the 7-day moving average, just to show some of the provincial differences. And I think just to note, Gauteng was kind of the first province that started with the fourth wave, reached a high of just over 40% in terms of positivity, and is now kind of decreasing consistently. And you can really see the other provinces that started thereafter. And so you do see this progression in terms of the positivity rates by province, and then similarly just slight differences in terms of when they peaked. But you can really see in the last 2 weeks we've had this consistent decrease in terms of the positivity rates. Also by age, I think just interesting, as the wave progressed, you can see that initially the wave was predominantly in the younger age groups. I think you can see your 20 to 29-year-olds initially had the highest percent positivity, and your 30 to 39-year-olds, 10 to 19-year-olds, those kind of peaked and decreased at the beginning, started decreasing with a peak in early December. And then you can see your older age groups picked up a little bit later, peaked slightly later, but that all age groups are decreasing. So you can see, although we had this higher percent positivity in the younger age groups initially, overall, you can see, quite similar peaks across the age groups in terms of overall positivity rates, and really encouraging that everything is coming down. So I think Omicron is really dominant in all of the provinces at the moment, almost 99% of the sequences. We have seen sustained decreases in the case numbers and percent positivity, but really, the coming down, the decreases are not as the same rate as we saw in terms of the increases. We've had a slight increase in the number of tests in this past week, but the percent positivity has continued to decrease in all provinces. We've had slight differences in the timing of the waves in each of the provinces, but cases seem to have peaked in all of the provinces and are decreasing. And then we also had these slight differences in terms of the age distribution as the wave progressed, with the spread from younger to older age groups. So I'm going to stop there and hand over to Dr. Jasat to just share the hospitalization and death data.
Good morning, Honourable Minister, to all of my colleagues and to the media and those listening out there. I'll be giving you an update on the fourth wave across South Africa using the DATGov hospital surveillance data. So the first set of slides I'd like to share just shows you the declining admissions in the fourth wave and the decoupling in terms of the cases and hospitalizations and deaths that we've seen in the fourth wave compared to the previous waves. And so this graph shows you admissions in grey, cases in black, and deaths in red, and that's a 7-day moving average for each of those. And what you can see in the fourth wave compared to the previous wave is what we've been terming the decoupling, which means that in the previous waves, we saw admissions and deaths rise in proportion to the rise in cases. But in the fourth wave, while we saw a peak in cases higher than what we saw in the third wave, the peak in admissions was much lower and the peak in deaths was much lower. So what this shows you is that while we had a huge number of cases in the fourth wave, we didn't have as many hospitalizations and deaths as compared to the previous wave. Just showing you the incidence risk of hospitalization by province, by week. You can see what was also a bit different in this fourth wave is that while the previous waves had a different evolution, starting in one province, moving to other provinces, and a long protracted wave over 2 or 3 months, this wave was very tight. It started in Gauteng, but within a week spread to all the other provinces. There was a sharp increase, a sharp peak, and all provinces started to show a peak and a decline around the same time. And as you can see, all provinces have consistently shown decreases in hospital admissions over the last 2, 3, or 4 weeks. Again, show you more data that demonstrates decoupling. This graph shows you the 7-day moving average for cases, admissions, and deaths in the fourth wave as a percentage of the third wave Delta peak. And what you can see is that the cases peaked at a higher rate than the Delta peak, admissions peaked at about 60% of the Delta peak, and deaths peaked around 14 or 15% of the Delta peak. What's also encouraging is that we're also seeing a decline in the weekly excess mortality reported by the South African Medical Research Council. On the top, you can see the excess deaths for those under 60, and you can see over the past 2 to 3 weeks, we've seen decreases in the excess mortality. And the bottom graph shows those excess deaths for those over 60 years. And we haven't yet seen a decrease in those over 60 years, but we are starting to see a plateau. And as Dr. Groom showed you, the rise and peak in cases in older people was a bit later than that in younger people. And so we hope to see a plateau and a decline in the excess deaths for those over 60 as well. But besides that difference between the age groups, what's also very striking is that even using excess mortality, we didn't see the rise in deaths as we did in the second and third waves. And so this fourth wave really did not see a huge rise in excess deaths, along with the sort of lower levels of reported COVID-19 deaths. So now some data from on severity in this fourth wave, and some of the data is updated from a preprint that we've submitted to the Lancet. So this table shows you a comparison of the full waves of the first, second, third, and fourth waves. Now, the median length of stay was shorter in the fourth wave compared to the previous 3 waves. The percent of cases who needed oxygen was lower at 22% compared to the previous 3 waves. The percent of cases who were treated in ICU was 5.8% compared to 15, 12, and 14% in the previous waves. The percent of cases who had severe disease was 31.7% compared to proportions of 52, 63, and 63% in previous waves. And the proportion of admitted patients who died in hospital in the fourth wave was 9.7% compared to 21.5% in the first wave, 28.8% in the second wave, and 26.4% in the third wave. And these graphs just show you the similar comparison between the waves. So you can see there was a lower proportion of cases admitted in the fourth wave, lower proportion required oxygen, lower proportion had severe disease, and a lower proportion died. So the other data I wanted to share was around admissions in children in the fourth wave. And so very early in the fourth wave, there was a lot of concern because we saw a big number of admissions in very young children. So this is a comparison of the 4 waves across the entire wave period. And for those over 20, you can see that the percentage of cases admitted to hospital in the first wave was 13%, second wave 14%, third wave 12%, but in the fourth wave was 7.2%. So there was a lower percent of cases admitted to hospital for those for adults. Amongst children under 20, the percent admitted to of cases admitted to hospital was 4% in the first wave, 4% in the second wave, 3.8% in the third wave, but 8.4% in the fourth wave. So there was a higher percent of cases admitted to hospital in this fourth wave in children compared to adults. And just looking at that another way, when you compare the 4 waves, you can see that in the fourth wave, there were lower proportions of admissions amongst the total admissions in those 40 to 59 and over 60. But in those under 20 and 20 to 39, they made up a bigger proportion of the total fourth wave admissions compared to what we saw in the previous wave. So there was a trend towards younger people making up a bigger proportion of admissions in this fourth wave. However, all indications are that the severity amongst younger people was also lower in the fourth wave as compared to the first, second, and third waves. And finally, just some data around vaccination, and just want to reiterate that this is self-reported vaccination data that's collected in our DATGov hospital surveillance, and it's not through linkage from the EVDS, and so it's therefore not complete. but we looked at the percentage of admissions and deaths that were unvaccinated in this fourth wave across South Africa. And you can see that we had data available for only 26% of all admissions, but the vast majority, 82% of admissions, were in unvaccinated individuals. It was much higher in younger people where vaccination rates are lower, up to 90 to 100% in those under 40. It was a bit lower in older people where the vaccination coverage is a bit higher and where they probably received their primary series of vaccination a number of months ago and are due their booster doses. On the right is the proportion of COVID-19 deaths in the fourth wave across South Africa who are unvaccinated. We had data for 32% of deaths, and similarly, about 82% of the deaths occurred in unvaccinated individuals. And so just striking the important note of the importance of vaccination. I've included a slide which I won't go through, but I'm happy to share these slides through Foster with all the media. But this is just a summary from the WHO technical briefing of all the evidence that we have from studies around transmission, pathogenicity, severity, and the impact of Omicron on immunity. And finally, just to summarize our own data, we are seeing a decline in cases and hospitalizations, and what is looking like a slower down wave compared to the very rapid up wave. In the fourth wave, we've seen a decoupling of cases, admissions, and deaths, and we did not see a breach in the health capacity in the fourth wave, despite having no increase in national restrictions. We're consistently seeing a decrease in severity and deaths in the fourth wave. A lower proportion of patients needed to be admitted, lower proportions of patients needed oxygen, ventilation, and treatment in ICU. But in children, while we did see an increased proportion of admissions of the total admissions in the fourth wave, we did not see any increase in severity or death even in children. And again, just to make the point that most admissions and deaths for those individuals we had data for were in unvaccinated individuals. Thank you so much.
Thanks very much, Dr. Michelle Groom and Dr. Wasila Yasat on that update as far as epidemiological report is concerned. Without wasting any time, I'm going to call upon Professor Glenda Gray, who's supported by Professor Linda Gail Baker, to share with us the findings of the Sisonke 2 trial, as people always ask us about the effectiveness or the importance of booster shots. So they're going to share with us the findings of Sisonke vaccine effectiveness. Over to you, Prof.
Thanks, Foster. Good morning, Minister, Deputy Minister, DG, DDG, and all my colleagues, all protocol observed. I'm going to present this on behalf of Linda Gail Becker and myself, who are the two national co-leads, and together with Nigel Garrett and Amina Gogo, who are also the who represent some of the leadership in the Sisonke 2 study. So just to give you a summary of the roughly half the people that were enrolled in Sisonke 1 got boosted at around 236,000 people, and mostly were in the Gauteng and in the Western Cape province. We will be tying up the Sisonke 2 protocol, and so we hope that everyone will see that how good the data is and encourage people who've had the single dose of the adeno or J&J vaccine get boosted. So as already Michelle Groom and Wasila have shown, even in the Sisonke study, we did see a decoupling or a delinkage of cases to hospital admissions. And this just shows you as a percentage of the delta, you can see again, the infections in the Sisonke mimic what has been seen in the general population. Overall, in the Sisonke study, we've had around 51,493 breakthrough infections, 11,586 during Beta, 10,625 during Delta, and just under 30,000 during the Omicron period. And we saw that the daily infections during Omicron were 3 times that seen in the Delta peak, and are clear decoupling as we've seen in the general population. If we have a look at the admissions, in the Omicron period, we see more females, but this is a reflection of the healthcare workers in South Africa. Most of the healthcare workers are female, but we also saw that they were much younger people. So again, mimics the same kind of what we saw in the data that's been shown in DATCOV, is that much younger people were more likely to be admitted, and because of Gauteng being the lead province, we saw more people in Gauteng being admitted into the hospital. as compared to the beta and the delta periods. If we have a look at, as I've mentioned before, more likely to be younger people, more likely to have HIV, and less likely to have other comorbidities as compared to the beta and delta period. So very important, to look at vaccination rates in HIV infected people and to make sure that people who are HIV infected get vaccinated, because we know that they're more likely to have adverse outcomes if they get COVID and they are infected, and particularly if those are not on antiretrovirals or immunosuppressed. So very important to make sure people who are HIV infected in our country are taking their treatment and have their regular boosts. In terms of the characteristics, again, like we've seen in the DATCOV data, is that the healthcare workers were less likely to be in ICU, less likely to need ventilation, and less need for oxygen as compared to the beta and the delta period in South Africa. So also very encouraging data from the Sisonke 2. In terms of vaccine effectiveness, we're very excited that we saw great protection against hospital admission in our healthcare workers. And so this slide just shows you, as we followed up healthcare workers who were boosted and looked at the durability of the vaccine. So in healthcare workers that had been boosted just between 0 and 13 days, because your immune system is evolving, we saw 63% protection against hospital admission. In those who had been boosted between 14 and 27 days, we saw an 84% vaccine effectiveness. And we see that this kind of vaccine effectiveness is maintained beyond up to 2 months. And so we are refreshing this data, but very happy to report very high levels of vaccine effectiveness against the Omicron in South Africa. In fact, this is the world's first evidence of vaccine effectiveness with using the J&J vaccine and demonstrating high levels of vaccine effectiveness. And just to show it in a different way, you can see the buildup of your immune response between 0 and 27 days, and then a maintenance of vaccine effectiveness beyond that. And as I said, we'll be refreshing this data again to see whether the durability is contained. So just very good, exciting news to encourage people who've had the single dose J&J to go and get vaccinated. We have real world evidence from South Africa that this vaccine protects and is very durable. There are other data that we're looking at in the laboratory that shows great protection, a lot of cross protection against Delta if you were vaccinated, and you also got the Omicron, saying a lovely cross protection to other variants. So very important to get your vaccination and to show the durability of the J&J vaccine. So I want to always thank everybody, particularly the South African government. This is a collaboration with the Department of Health, and without the funding from Treasury and the NDOH, we could never do this work, as well as the collaboration with the EVDS and the national vaccine rollout. Without them, we couldn't do this kind of study. So we just want to thank everybody that have been involved, and just people who've worked very, very hard with us to get this data. And just thank you again to the DG and the DDG for all their support on this. Linda, I'm not too sure if there's anything else that I've missed that you want to just talk about going forward.
All good on my side.
Thanks.
Wonderful. Thanks to the two professors, Professor Linda Gray and Linda Baker, for sharing the findings as far as Sisonke 2 study is concerned. Without wasting any time, I'm going to call upon Dr. Nicholas Trace to share with us the update as far as the vaccination program is concerned. Over to Doc.
Thank you very much, Foster. Good morning, Minister, Deputy Minister, DG, and colleagues. What I would like to do is just show the changes in the public dashboard and give some quick highlights on the numbers. The Minister's already given them in the introduction, but we are approaching 29 million total doses given. And you've seen the daily breakdown, the provincial breakdown of those doses. From last night, the dashboard is now showing booster doses, which is a positive change in the dashboard and making it possible for reporters and people who are interested in following the separate information. There's more disaggregation in the data, and that was the main thing I wanted to show. So that was in the last 24 hours, and you can see also in the total number of vaccines that were administered, also the booster doses are illustrated separately now, and you can see the first and second doses separately on the graphs. It's early days in the boosters still, as we opened up for booster administration only in the Christmas period. So the major total booster doses that you've seen is this 236,669, which is amongst healthcare workers. Just to illustrate, those who have access and see these graphs often on the internet, this is the general trend of each province of the decrease in the daily vaccination and weekly vaccinations we're seeing. We dipped now during the Christmas period quite badly, as the minister said, but we're already starting to see a recovery of the vaccination program, and we hope that as the vaccination sites come up and people get back to work and their normal lives, we will pick up, as we have seen from the presentations so far, and you're going to see just now from Melanie Wolmerans, the impact of vaccination on everything we do. So this is the challenge that we have. It's amongst the younger population between 18 and 34 and 35 and 49, where both men and women are not as well vaccinated as we need to protect them from severe illness and being admitted into hospital. So although the numbers look quite big, as a proportion of those total populations, we are not doing as well as we need to be. The total number of individuals vaccinated per week, one can follow this on this screen. This is the adult population over the age of, excluding the 12 and 17-year-olds. And the total number of individuals vaccinated now exceeds 18 million. Still a long way to go to the 40 million. And the breakdown further, I won't dwell more on this, the total adult population again, where you can see that the population is just under 40 million. There's the 18 million that we are trying to reach, which is the 45.58. But we want to emphasize, and you're going to see it in a moment when Melanie presents, that it's the older populations down here on the right-hand, bottom right-hand corner of this slide, where over 60 population across the country is 66.56% are vaccinated and 62.38%. And if the previous presentations have shown us, this is the population who has had the least impact in Omicron, and largely because there's been such good vaccination coverage. In some districts, that coverage is already over 75%, as the minister said. This was already presented, so I'm going to skip that slide. And this is also just another way of showing each of the four major age groups that we are concentrating on. We are now trying to increase the target or the vaccination to up the targets in the younger age groups, because we're very happy with the vaccination in the older age groups, where we just want to encourage people to come for their boosters. And I'm showing the boosters. So just this is pretty much the same information. The fully vaccinated, you see the same sort of layout. 16 million people have been fully vaccinated in the adult age groups. That's just under 60% now fully vaccinated, and we're moving into the booster campaigns. You will now be able to see separate sheets for the 12 to 17-year-olds first and second doses, and you are able to see also on this screen the number of booster doses on a separate sheet. So I'm going to stop presenting here. Thank you very much, Foster, because it's more important that we see the new sheets that are going to be incorporated, and Melanie is going to take us through that. Thank you very much.
Thanks, Doc. I'm going to hand over to Melanie to take us through the new changes as far as dashboard is concerned. Over to you, Melanie.
Good morning, and thank you, Foster. Good morning, Minister, Deputy Minister, DG, colleagues, members of the media, and everybody that's listening. So I just want to confirm that you can see my screen.
Yes, thanks.
Okay, I'm going to take you through a navigation of the page that will be added tonight as part of the publication of the vaccination data that we publish every evening on the SA coronavirus website, as mentioned by Minister in the introductions or into his introductory remarks. So this is the page that will reflect hospital admissions by vaccination status. It's important that you look at the date when you look at this page, as we are sometimes experiencing a delay with regards to the .gov data. So this specific page is looking at the linkage between those that are admitted and that are reported by all the hospitals on the NICT.gov and link that with individuals' vaccination status. And then the analytics are being done and presented in the specific page. So if I can quickly just orientate you on the details of this page, it's containing quite a lot of information and it's completely interactive, and I will try and take you through that. So first of all, the first bar at the top will give you information around the total number of individuals that is in hospital, and just the total number of people that's in hospital with COVID-19. It then breaks it up in terms of vaccination status. So on the far left, it will give an indication of the number of people that's not vaccinated that is in hospital. So of this number of 7,826 individuals that's in hospital with COVID-19, 5,731 of them has not been vaccinated. 321, this is the middle block, is those that has not been fully vaccinated. So in real terms, that means that they've only received 1 dose of Pfizer, and it's also related to the timeline post-vaccination, and I'll explain to you that just now. And then if we look at the far right, then that gives an indication that of the 7,826, 1,774 were fully vaccinated. Then it further breaks it down to indicate how many of these 5,731 that's admitted in hospital that were not vaccinated. 4,976 were admitted in a COVID ward. 359 was admitted in high care, and 396 were admitted in ICU. And then similarly, the data are being disaggregated to include the of those that has not been fully vaccinated. 262 were in the ward, 22 in high care, and 137 were in ICU. If we then look at the fully vaccinated, 1,406 of the fully vaccinated were in the ordinary COVID ward, 114 in high care, and 228 were in ICU. So all of this data then are being presented in graphical form at the bottom. If we look at the first stack graph, then it gives us an indication of the sex distribution between the admissions. The red is the unvaccinated, the orange is those that are not fully vaccinated, and the green is those that are fully vaccinated. So if this is the sex distribution between the two, male and female, and then we also have a group that we do not have the information. So if you hover with your mouse over the stack graph, it will also provide you with the details that you are looking at. The next stack graph indicates the different age groups, and here we can then specifically look at the age group of the 60 plus, where we can see that of the admissions of those that 60 plus, 247 were not vaccinated, 156 were not fully vaccinated, and 997 were fully vaccinated. If we look at the far right, in terms of the little people here, this you need to carefully look at the legend at the bottom. This is just to indicate the proportion in a pictorial form in terms of those that's not been vaccinated, which is the red, those that it has been vaccinated, which is the green, and the orange are those that has not been fully vaccinated. As I've indicated, this is fully interactive. It's possible to select a specific province. I'm just going to select the Western Cape. And then everything on the specific sheet will change to give you the details for the Western Cape. It's possible to select multiple filters, so we can specifically look at in a ward. Then everything will change to give you the data to say that at the ward level in the Western Cape, this is currently the information around those that has not been vaccinated, those that's not fully vaccinated, and those that are fully vaccinated. It's also possible to look at age groups. So if we look at the 60+ population, then everything will then again change to provide us with the information around the 60+ population. So if we now look at what is presented to us in front of us, then of the total number of individuals that's admitted in the Western Cape with COVID-19, 594 is 60 years and older. Of the 594, 326 have not been vaccinated at all. 27 has not been fully vaccinated, and 238 is fully vaccinated. And then we can see that of those that are fully vaccinated in the 60+ population, there's nobody in high care and nobody in intensive care. All those of the 60+ population that's fully vaccinated, that's admitted in hospital, is admitted in an ordinary ward. It's also possible to then look at the different sex in terms of male and female, and it's also possible to, at the top, just select, for instance, fully vaccinated, and then the whole slide will update again. So we trust that this will provide more information to the public and the media in terms of vaccination status of those that have been admitted in hospital, and it actually presents us with a clear picture that vaccination is a defense against COVID-19. Thank you very much.
Thanks, Milani, for that update. We believe this will assist us to limit the volume of media and public inquiries, and will also assist the people with access to information in order to make well-informed choices. Thanks for that presentation. We believe this will be live immediately after, or it's already live, I believe. It's already live as we speak, so that people can be able to access.
Sorry, Foster, just a correction. It will be published tonight at 8 o'clock when we publish all the other dashboards on a daily basis, and it will be updated daily. Thank you.
Okay, thanks very much. So without wasting any time, we are now in that moment of question and answers to respond to a number of questions that we've received. So far, we've received about 15 questions from members of the media. I'm going to break this into two rounds. I will take the first batch of questions, about 10, then we'll take the second batch. Minister and members of the panel, the first batch of questions read as follows. Question number 1, I know, just to clarify, I know some of the questions have been answered on the chat, but for the benefit of those who are watching on TV, following through other channels of communications, I'm going to read these questions so that the members of the panel can assist to clarify them so that everybody will get answers. The first question reads as follows. I need clarity regarding the quarantine and isolation period. On the 23rd December, these regulations were changed, and then a week later, the decision was made to recall. However, when the Department of Health calls patients, the contact on, in fact, when the Department of Health calls patients, they tell contact not to quarantine, and the persons who are ill must isolate for 8 days. This is creating confusion. So in short, this is related to the circular that we issued on the 23rd of December and later had to put it on hold a few days later. So they just need clarity on that. Second question from Sumen Naidu, a freelance journalist. Can the department provide an update on considering a proposal by the Department of Basic Education to reduce social distancing in schools? Third question, there are some calls for full-time return of students. Is there any early indication by the department when the 5th wave will hit South Africa? When will the 5th wave hit South Africa? The fourth question, is the decision to lift the curfew did take place at our healthcare system under any pressure, or were they able to cope? Is the decision to leave the curfew had any impact on the health system? Were the health facilities under pressure, or were they able to cope? The fifth question from Luke Daniels from Business Insider SA. What is the new targets for the country's vaccination rollout? Initially, 70% of the population, or 70% of the population was due to be vaccinated by the end of the year, and this target was then pushed until the March this year. Currently, 40% of the adult population is fully vaccinated, which puts the country far off March targets, with daily vaccination having never reached the present target of 300,000 per day. So clarity on that. The fifth question, the president has put a lot of emphasis on this target, alluding to lockdown being lifted in its entirety once the target or the herd immunity has been met. Is the country's program still regarded as feasible key to ending the lockdown? If not, what now needs to happen from a public health perspective for lockdown to eventually be lifted completely and the state of disaster revoked? The last two questions from Ryan Brothwell. What legislation or other legal mechanisms is government considering around lifting the national state of disaster while keeping the COVID-19 restrictions in place? Is there a time frame as when the state of disaster is expected to be lifted and replaced with COVID-specific regulations? The last question from Aisha from Wall Street Journal. This directed to Dr. Groom and Dr. Yassat. Are there any longer-term conclusion about Omicron being assessed currently, and what can be said about the level of defense that prior infection provides against Omicron? I'm going to read the very last question before I hand over to Minister and the members of the panel. Are the PCR tests still required for entry to enter the country for fully vaccinated citizens? Are the PCR tests still required in order to enter the country for fully vaccinated citizens? I'm going to stop here and hand over to Minister and members of the panel to respond to these questions. Over to you, Minister, and the members of the panel.
Okay. Thank you very much, Foster. I'm trying to quickly allocate. I'll deal with the first one, the one on basic education. On the first one, I'll start and DG can add. On the second one, I'll ask Dr. Crisp to respond to that. The third one calls for any indication about 5th wave. I think on that one, possibly our colleagues from NICD could comment. Maybe Professor Tlenda can also venture into the 5th wave. I'll leave that to the scientists. That is number 3. Number 4, about the targets. I think, if I'm not mistaken, Foster, 4 and 5 are very close to each other. And in lockdown, I'll deal with 4 and 5. And then number 6, also on amendment of legislation, I'll deal with that. Number 7, okay, that's specifically to colleagues from NICT. I think number 8, DG can, together with Dr. Crisp, can deal with PCR test required for entry. I think the two of you could handle that one. Just on the first one, it is true that there was a circular and then which was withdrawn. This circular was as a result of advisory from our Ministerial Advisory Committee. The substance of it, therefore, we agreed with. The only reason why the circular was withdrawn temporarily was to deal with some matters which needed further consultation. Some of it within government, there were a number of matters which we needed to align with other provisions of the Disaster Management Act. There needed to be further consultation, but also just to allow other members of society if there were any other comments. We're almost done with that. So, but because the substance of what has been advised by the Ministerial Advisory Committee, we were in agreement, including reviewing of the periods of quarantine and how to deal with the spreading and so in practice, that's why you will find that the health facilities would have been already implementing some aspects. But to clear up the confusion, in the next 7 days, we should be able to come back to the public with the situation properly clarified. We are done almost with the alignments and the consultations which needed to be done. But I want to emphasize that the body of substance had never been at question in terms of what we had been advised. So there are just a number of areas where we needed further input, and that has now been done. And we're able to, reformulate. There will be minimum changes, but because of the fact that we needed to align also based on inputs and also on regulations arising from the disaster management, which also we had to make sure that there is that alignment. So that is on course. So that I don't come back faster, let me deal with 4 and 5 so that I don't have to come back, which have to do with the targets. Let's just say basically that in my introductory remarks, I did say that our target is still informed by population immunity or herd immunity, which has to be coverage of between 67 and 70%. So that remains of our target in terms of the adult population coverage, at least 67 minimum and up to 70% of the adult population to be vaccinated. Now, that is why when you look at the preparation in terms of supply and in terms supply of vaccines, how the number of vaccines we acquired through purchasing, and also the capacity which we created to vaccinate the sites, the personnel, and all that is available we could have reached this 70% by the end of December. Where we fell short is in convincing the population to come forward and receive the jab. At least 45.5% did come forward, at least for a jab, and 40% for a full vaccination. So we are short by 30%, not because we didn't create the capacity, but we are lacking in terms of the messaging, reaching the people and convincing everybody who is eligible to come forward. So that's why in my remarks, I did say that we are still going to do everything we believe is possible, and we appeal to all South Africans who agree with what we are trying to achieve to free the country from the clutches of COVID-19. We invite everybody, the media, all leaders of society, who can bring fresh ideas in terms of the issues which we need to respond. What are the things which still make people hesitant, so that we can respond to those? So we're putting some effort to get deeper into those issues so that we can be able to reach the 70% of the population. So that target, we have to do everything to make sure that we can reach that target, so that the country can ultimately have a chance to go back to normality, socially and also especially in the economy. So if we do that, because we don't know what further changes in the virus and in its severity, in its virulence, and in its transmissibility. So we must do what we can to manage it. And doing so, as we have seen during this fourth wave, we have managed from the experience to really balance between lives and livelihood. Not much of severe harsh lockdowns. We've managed, and if more vaccinations happen, then there will be even less need for that. The president has put emphasis on targets. I think I've dealt with that. And if, again, just to say that if we can cover more people, then there will be less need for even some of the restrictions. And then, of course, lastly, the question was whether legislation of other legal mechanisms considering. Yes, we are. The health department and also justice and COGTA have been given the task by cabinet to look at other regulations, largely Health Act regulations under the Health Act, and also any other under the other departments. So there's a team which is almost also finalizing that. We will be going to NCCC and cabinet in the coming week, or in the next 7 days. We should be able to report and make proposals. And depending on how far this can cover all the requirements to assist society in preventing super spreader. If we can find other mechanisms, and the team, our expert teams are looking at other mechanisms, when that is agreed, but we are not going to simply rush under the pressure of those who are saying do away with the disaster, because the disaster is not really because we like it. It's simply a measure currently to protect the country and its population. So we are busy working on this. Cabinet has given us very clear instructions. Our teams are working, and they will be reporting in the next 7 days to NCCC and cabinet with some proposals, which must be interrogated. If they are found to be adequate enough, there will be some adjustments which the president will be able to announce at a future date. Let me then hand over to other members. I think I said on number 2, if Dr. Crisp, and then together with the DG on the PCR for traveling. Over back to you, Foster, then with that kind of allocation.
Yeah, I'm going to allow the Dr. Crisp and other panelists as you've allocated to go through a minister.
Okay, thanks very much, Foster. Thanks, Minister. So the Department of Health is interacting with several departments on queries around control measures and infection prevention measures, including the Department of Basic Education. There were meetings earlier this week, and those discussions are ongoing. It's all part of a review of everything that we do in the response to COVID, not just vaccines, but the way in which all the control measures. And as the Minister said, there's a lot of work that's being done to look at legislation and the provisions of various regulations and so forth. So none of this is being looked at in isolation. It is part of a bigger review. So yes, we are looking at what it means for schools and getting schools back to normal. Thanks. And then I think there was a second question about PCRs. At the moment, that also is on the agenda for discussion as part of, what is the role of PCRs going forward and of all testing. And as I think the media and the public are aware, we've been involved with the Competition Commission looking for cheaper prices for tests, but we need to be looking at all of these measures and all of our diagnostics and interventions to see how we use our resources more effectively and in a more targeted way. So this is also being looked at the moment, but for now, yes, it is still required for entry. Thank you. I'm not sure if the DG would like to add or if I've covered. Thank you.
No, thanks. I'm covered, Dr. Crisp. We can allow Professor Gray and the other team members to come in. Thank you.
Thanks. I think in terms of the fifth wave, we have to see what the winter months will bring. You know, we have to, this year will teach us whether we are moving towards a more endemic nature of SARS-CoV-2. But as long as we have ongoing transmission, there's a possibility of viral evolution. And so it's going to be critical for us to continue the excellent surveillance that we do and try and make sure we can pick up any variants that may cause a next wave. So the winter months will be critical because it'll give us a direction about whether the fifth wave will be less than the fourth wave and whether we are on our road to an endemic status. But this is also prefaced by the need to vaccinate. And so we can help control the fifth wave by making sure that we increase our vaccination rates. But winter months are going to be very important for us as we see what happens, and we need to continue with the surveillance. In terms of the schools, just also update DDG and DG is that there is a technical working group run by Professor Stervalapi that's been convened in the next two or 3 days to help the Department of Basic Education address some of the issues around spacing and how to optimize the academic year for schools, so that there'll be some recommendations made to the minister and for their consideration as well in the next week or so. So thank you on that. Maybe I'll ask Michelle and Wasile also to comment on the fifth wave.
Thanks, Glenda. And yeah, so I think in terms of the fifth wave, I think we're fairly sure there will probably be a fifth wave. I think as to the timing, as we've seen with the other waves, I think very difficult to predict an exact timing. But as with all the other waves, I think there's multiple factors which do play in. And as we've seen with all previous waves, it has been driven by a new variant. So I think very important that we keep monitoring through our sequencing. I think we've proven that we have very good sequencing capacity here. And so really just to keep a track on that. I think really positive that we've come through the fourth wave without having to increase the restrictions. And so things like behavior, maybe, you know, we will not play as much of a bigger part as we're not coming out of high restrictions to lower restrictions. So I think we really can't pinpoint, but obviously we'll keep monitoring, and in terms of the way that we'll conduct surveillance moving forward, also just need to rethink with this move to endemicity, you know, in time. I mean, it's not a definite move from pandemic to endemic. You know, it's a process and will occur over time, and very difficult to predict how long that will take. Just to address the question in terms of the ongoing research on Omicron. So obviously there is more data coming out from across the world. South Africa was pivotal in providing some of that initial data, and I think more and more data coming out on Omicron. In terms of reinfections, we do know that prior infection does provide protection against severe disease, but very difficult to be able to always pinpoint who has had prior infection because there's a lot of asymptomatic infection. And so there are those ones that we know are being reinfected, but there are many that, you know, never tested when they had their first infection or are being reinfected and never tested. So a bit more difficult to assess that. But I think even in those who have been infected with COVID, studies are showing that vaccination will provide further protection. And so you'll get additional boosting of the immune system through vaccination. So even those who've had COVID, I think would benefit, important that you will still benefit from vaccination. Thanks very much.
Just wanted to come in there to add to what Michelle has been saying. I think while we're clearly seeing a lower rate of severity with Omicron than we saw in previous waves, the question is, why is that? And we believe it's a combination of prior immunity from vaccination and previous infection, and possibly intrinsic lower virulence of this variant. So there are some studies coming out, tissue-based lab studies, that show that the tropism of Omicron is that it favors the upper respiratory tract compared to Delta and the wild type virus that had affinity for the lower respiratory tract and replicated faster in the lungs. And so that might explain why we saw less patients needing oxygen and ventilation and getting critically ill with Omicron, because of the affinity for infecting and replicating in the upper respiratory tract more. Also, some studies on hamster models and on the cleavage of the variant showing that it's likely to be less pathogenic. And in terms of immunity, I think we did see that there was an increased risk of reinfection from data in South Africa, UK, Denmark, and Israel, and that there was reduction in the sort of ability of the vaccine to protect you and neutralizing titers in Omicron. But then, encouraging studies are showing that the vaccine effectiveness is maintained against hospitalization and severe disease, even if it may not be protective against infection and symptomatic disease. So these are all encouraging, and I think certainly the data that Prof. Gray presented on the J&J booster as well is showing that the boosters are increasing vaccine effectiveness, and emphasizing the point that what we saw with Omicron is possibly a less virulent variant intrinsically, but also some protection from vaccination as well. Thanks.
Yeah, Foster, LGB here. I just really wanted to emphasize what Wasila's just said. It's a point I wanted to make, that what has been consistent across all 4 waves, and I think it's important, particular that media and the viewers pick up on this, that we have had consistent protection against severe disease and death. Well, should I say the last 2 waves where people have been vaccinated. And I think Sisonke has shown that we see that protection against severe disease and death, even though, as you saw in Sisonke 2, we had an increase in infection. We had ongoing protection against severe disease and death. And so that, I think, is an important message. We did not necessarily yet tease out the 2 kinds of boosters, but I think we'll be seeing that data in the future. I think the overall message is that boosters add protection for, in the face of variants. Thanks.
Thanks, my colleagues, for responding to the first batch of questions. I'm going to take the second batch, which is the last batch, unless there will be follow-up questions. So I'm going to take all other questions that have not been answered to. We've got about 11 questions so far. The first question is from Alistine from Spotlight. Can the DG or Minister or Dr. Chris please provide an update on progress or status of the disciplinary cases against the 6 officials implicated in the SIU report? Second question from Luke Daniel, directed to Dr. Chris. Can you elaborate on these age differentiated targets? What percentage of each cohort vaccinated by when? And if these targets will still be used as a measurement of ending the state of disaster and ending the lockdown? Christian Duplessis from News 24 or Network 24 is asking, why does the department first want to implement the new regulations in other laws before the national state of disaster is suspended? What can we do at this stage without the national state of disaster? Would you encourage companies whose workers are working remotely or from home to return to work? What strategies such as contact tracing and temperature screening is the department currently reviewing, and why? According to a study by Oregon State University, 2 compounds found in hemp were identified as having potential to combat the coronavirus. Does marijuana actually protect against infection from the virus? Matlas Mpatlela from Times Live is asking, what is the logic of continuing to have taxis, pubs, restaurants, workplaces, schools at full or half capacity, but not at sporting stadiums? At most of these places, there are no checks whether people are vaccinated or not, while at stadiums, vaccination status can be checked. Kelly from Independent Media is directing the question to Minister, but the colleagues can still assist. Minister will still decide how to go through this one. is it safe to say that Omicron variant is on its way out or gone? Is there a predicted time frame as to when the variant will be filtered out as the Delta variant was? What could be the reason why the fourth wave has been less severe? The last two questions, people who want to vaccinate but don't have any form of identification, how do they get sorted? This one brings us back to that issue of undocumented and homeless people. So how do we assist those people who don't have any form of identification? I believe colleagues will be able to answer that one. The last question, Africa's health body has joined talks with Pfizer about securing supplies of its antiviral COVID-19 pills for the continent. How soon could we receive the pill and how will the distribution work? Just to touch on the first question, the person who sent the first question on the first batch is still feeling that we have not, or the second question from Sumen Naidu, freelance journalist, she feels that the question is not fully answered. The question on the curfew, the impact of curfew on the health system, whether did we experience any pressure from the health system or healthcare facilities? So can you also try to revisit that question? It was question number 3 or 4, which talks about the curfew, the impact of curfew on healthcare system. So this brings me to the last question of the second batch. Over to you, Minister and members of the panel.
You will help me. I lost you. I had not followed clearly the second batch. Just quickly so that we'll do that. DG, can DG quickly just deal with this disciplinary process question related to digital vibes while I'm busy just trying to see the others. Over to you, DG, on the where is the process of I think that was number 9, which is your number 1 now. Over to DG, then I'll be looking at the others.
Thank you very much, Minister, and thank you very much again, Foster, for the questions. The disciplinary processes that relate to digital rights, they were divided into 2. There were those that were done through the presidency and those that we are doing direct the department. The ones that were done by the presidency are now finalized and closed. And then the ones that we are dealing with the department are currently ongoing, and we hope to be to have everything finalized by the middle of February. But they already started, and the legal teams are actually dealing with the matter. And we've given them timeframes that we would like the matters to be finalized by latest 15th of February. Thank you very much, Minister. I think the next one that I want to quickly answer, Minister, that is there is the one of the oral Pfizer pill for COVID, which is Paxlovid. We have met with Pfizer. Maybe just to let you know, the procedure in the department is that we have a committee, an expert committee that actually reviews all the drugs. It's called it's a National Essential Medicine Listing Committee. There's still no public data available for them to be able to assess so that it can be included in the formulary. And Pfizer has been advised accordingly. And once that data is available, that committee will review it, and then a decision will be made if it could be included in the formulary for the actual treatment of COVID. Thank you very much. I can then revert back to the minister.
Okay, if we go to the age differentiation, Dr. Crisp, what is the aim of having targets with age differentiation? And I think, yeah, if you can deal with that while I'm trying to see what else to allocate.
Thank you, Minister. So the target the Minister has explained is very clear. We still want to get to 70% of adults that are vaccinated. But we also want to make sure we have equity, that across the country, populations are equally or equitably vaccinated, and we don't just have a concentration in some place, and that applies across the ages. So we started with the older age, and many of the populations are already way past 65% vaccinated, as I indicated. And so it goes down to the younger ages. So for now, for administrative purposes, we are meeting with the provincial administrations and the private colleagues who deliver the services, and we are setting systematic targets so that they have a tangible number that they can work a strategy, work out their vaccine procurement, and that they can not just have an end goal, but have incremental goals over the next few months. So for now, yesterday we met to discuss the next 3 months. What are the targets that we think are feasible, that they can start to prepare their workforces and their vaccines? So it's really an administrative procedure. And as the minister has very clearly outlined, we need to get 70% of the population, the adult population, vaccinated. And what we've seen is it's probably a good idea to do the same with the younger people as well. Thank you, Minister.
Just so that you can prepare, sorry, I will deal with 11 and 12 on the regulations and the state of disaster. If I can ask DG to be ready to come back on return to work for those who are remote from companies, what advice? And then the issue of contact tracing, what are we reviewing in that case? If DG could take those two. And then if Professor Tlenda could help us with the hemp, in hemp. I'm sure she can tell us more about that if she's familiar with that. The taxes and then not allowing stadiums. Between DG and Dr. Crisp, I'm sure you could look at that. What is the logic of not opening stadiums? Number 17 on its way out. Okay, I'll take that one. And then number 18, I think Dr. Crisp is well suited for that. And then the last one on the pill. Oh, DG has already dealt with number 19. Okay, just I'll combine 11 and 12, which is about why do you want to get new regulations instead of the before the national disaster is no. As I said it earlier on, these regulations are not really just for luxury. It's just measures which the state, as the state is responsible to do everything possible to protect its population. Now, these measures are simply for that. Now, so if there was no need, the government could tomorrow lift the state of disaster. If tomorrow we are told that COVID-19 is no more a threat, there will be no threat of the pandemic of people getting sick, admitted to hospitals, overwhelming the threat of overwhelming health facilities and so on, of serious illness is over. There will be no, I mean, the state of disaster will be gone. But unfortunately, we can see elsewhere in the world, we're not an island, we can see countries which have opened up, relaxed, and then come back. But we don't want to be a yo-yo like that, this way, that way. So we're trying to assist the population by being predictable in terms of the way we manage things. So that's why then we want to make sure that as long as the threat is there, even as it seems to be reducing, we'll then look at other measures. So you can't just wake up and say this one is gone. We have to look at this aspects we can do without, and if we put in other measures, not disaster, but under health, under justice, under COCTA, this can be the risk of crowds and this and that can be controlled, and the wearing of masks, social distancing, all those things, regulations can still be there under different rules. Then that's what we're looking at until the threat of this is over. So yeah, so I think I've dealt with 11. So we can't just by wave of a hand and then just do away with these measures. So that was in terms of 11 and 12. The other colleagues will deal with others, just so that I don't need to come back. Number 17, Omicron, is it on the way? Is it gone? Is there a predicted time frame as to when the variant will be so on? Okay, I'll venture into that, but I think the scientists can come back to that. Our understanding is that at this stage, the variant which was named Omicron by WHO, as shown by Dr. Michelle Groom earlier on, it's still there. And in South Africa, is the dominant variant. In the world, it's spreading in some countries like the US, resulting in more than 1 million new infections in one day. Other countries, 100,000. So the Omicron is not gone, it's here. It's only that, fortunately, as we have said, its severity has been manageable. So at this stage, as to when it will be completely gone, as already mentioned, we really don't know. But what could be reasons why the fourth wave has been, I think that has been responded to. Vaccination is one. Also, the fact that many people have had some natural immunity as well. If you add that with vaccination, even stronger. And also, as Dr. Wasila Jassat did say, they said that the variant itself may have been less virulent. Combination of all those have led to what we see now. So I think I've done with that. Can I then get back to DG about the remote work and on 13, and also what contact tracing, what are we reviewing? Over to you.
Thank you very much, Minister, and thank you very much again to the colleagues. Firstly, the whole issue of return to work and remote work was actually done through the directions that were done by the Department of Employment and Labour, signed off by Minister Nancy. That process is advanced in terms of reviewing that at a network level. There is actually a meeting on Tuesday next week. We hope that we should be able, working through network, to have those directions finalized and then being then gazetted appropriately. And they will then deal with the issue of remote working and the other issues within the workplace. So that's where that process is. We are participating, but of course it's done through the network level. And then in terms of the following question that deals with what are we reviewing and why are we reviewing it, you will all note that these measures were put in when we were earlier in the epidemic. And since then, there's been a lot of data and a lot of research that has been done by our scientists. That's why we've been modifying as we are moving forward. So basically, we're being driven by science and data to review some of these issues to see if we can adjust them as we move on. Because I mean, when we started, we had to be quite very careful as we were starting to gather more data in terms of the different measures, whether they make any sense. But also, as the minister has mentioned, the situation is changing every day with more people getting vaccinated, with more people having had natural immunity from the past infections. So that is actually what the science that is informing us on why we should be reviewing some of these measures as we move forward. Thank you very much, Minister. I can then allow Dr. Crisp to add if he has anything to add, or then Professor Glenda Gray and Professor Linda Gelbeck.
Thank you, DG. Thank you, Minister. So there were a couple of questions. I won't cover anything the DG's covered. Absolutely, those are all answered fine. Now, we were asked about people who want to vaccinate and don't have any form of identification. There is a program that we have developed. So technically, the ability to give somebody a health ID does exist, only in the public sector facilities and only in a number of the major centers where there are concentrations of people who are undocumented. The challenge has been to upscale the program. So the coverage of that sub-program has been small and not really satisfactory. So it is on our list of to-dos because we believe there could be as many as 3 million people who are undocumented. We've been working with non-government organizations and religious groupings in a few centers to try and identify where there's concentrations of these people, and then with the provincial administrations to outreach to get to them. There's no reason why, technically, why we are unable to reach people who are undocumented anymore. We are able to capture that information. I was also asked if I would cover the issue about the curfew. So just very briefly, a curfew is not in place to stop a virus transmitting. Clearly, viruses transmit day and night, and it's related to where we are. The purpose of the introduction of the curfew was to reduce the pressure on the hospital, emergency systems, and intensive care units. And we know, and there's been lots of data presented, even on some of these morning meetings, that when you have a lot of alcohol and partying and people driving fast around and making merry, you run a risk of more accidents, more pedestrians being driven over, and therefore a greater pressure on our health system. But at the time prior to the festive season, we were already experiencing low pressure on the intensive care units. And so there was no real justification from a health systems capability perspective, neither in the private nor the public sector, to maintain the curfew over what was clearly an important period for people to rest and let off a little bit of steam. So yes, the health system did take strain over those periods. Everybody watches the news and sees all the accidents. Those people do end up, those who survive do end up in our intensive care units, and it does create pressure, but the system has been able to cope. I think there was one other question I was asked to look at. Yeah, the logic of continuing to have taxis, pubs, restaurants, and so on, but sports stadiums only half full. We work very closely with the Department of Sports and Culture, Sports Arts and Culture, about stadium control. And stadiums not just about where you sit in the stadium. It's about queuing. It's about going to toilets at halftime. It's about exiting. It's about control of people in a big environment. So it's way more complicated than a very simple answer to answer here, where you could have 40 or 50,000 people in a space. And we do know that when we put large numbers of people into a space and somebody is infected, we do create super spreader events. So it has to be carefully managed, and we're not advising on our own. We're working closely with the affected parties. Thank you.
Thank you very much. While Prof. Glenda comes in, can I have Deputy Minister Lomo on standby just to add something on the sports issue? He's been working with Minister of Sports and DP on return to play. I'm sure he can add on the efforts to try and encourage actual return to spectators. But Prof. Glenda, in the meantime,
Thanks.
if you know something about hemp, which we don't know.
Thanks, Minister. Yes, at a global level, people look for compounds to screen for to work against diseases. And so these scientists were using a screening tool and identified 2 compounds coming from cannabinoids, the CBGA and CBDA, and they put these in a petri dish with human cells, so cells from the epithelial lining, so the respiratory cells that are important for transmission. And they found that these 2 compounds block the spike protein, and the spike protein then can't enter the cells. So these are laboratory models that show in a petri dish using human cells that these 2 compounds are capable of blocking SARS-CoV-2. So what you have to do now is then is synthesize the molecule, and then do your preclinical work, and you do your then your human work. And so it's very important, to look at this, and hopefully they tested it against the alpha and the beta virus, but variants, but not against Delta or Omicron. So we don't know whether it works, but in those 2 variants. But I think it's important to identify new compounds, and if these compounds can be synthesized and be shown to be effective in clinical development, then it'll be good to use them. But I think the discovery is important, but there's a long way from identifying 2 compounds to making it into a drug. that can be used for treatment, but hopefully there will be ongoing work. LGB, I don't know if you want to say anything, but I think it's important to note that just based on these two data, it doesn't mean that smoking weed or taking marijuana is going to protect you or improve your treatment against SARS-CoV-2.
Exactly. Just the point I would have made is early days, let's hope, but it's a long way still to go. Thanks.
Thank you very much. Foster, can we get the Deputy Minister, and then I'm sure you'd want to wrap up. It's been a long morning. Deputy Minister, on the sports issue.
Yes, yes, the Minister, the DM can come through.
I'm not sure whether, Foster, you'll also want me to do the thanking of the Minister. If that is the case, let me just check from you, Foster. But let me then say, yes, the Minister, is true. The Deputy President has taken this return to play campaign in the country, supporting the Minister of Sports, Arts and Culture. And the department has always been asked, the Department of Health has always been asked to be in those meetings to provide updates on the vaccination status of the country and encouraging messages. In those, they have gone to all 9 provinces except Limpopo and Free State, where the message is also carried by the sports stars, the sports fans, and the artists. The message is that they would like to go back to what is their own trade, and they would want to go back to entertain us, but if we are vaccinated. So that message has been carried through in most provinces, and we are seeing, and when we get there, certain stars, certain sports stars and artists come up and vaccinate publicly. And that has been extremely encouraging to the public and to the people who actually want us to go back to entertainment, to festivals, and the stadium. Thank you very much, Foster.
Thanks, DM, for that clarity. That was the last batch of questions. Maybe before we do the formal closure, can we check if the Minister has got the last parting shot, Minister?
Well, really, nothing much to add, colleagues, just to emphasize again to our media people to help us again spread the message that opening up the country, doing away with the disaster management, all those things are possible. They are in our hands. The facility, which is reliable, tried and tested, is vaccination. And it's free and it's available. So it's in our hands. We can free the country from the clutches of COVID-19. Thank you very much.
Thanks, Honorable Minister, for that parting shot. Now I'm going to officially hand over to the Honorable Deputy Minister, Dr. Senitomo, to wrap up before we close. Over to you, DM.
No, thank you very much, Mr. Foster, and to our Minister. The Minister in his opening remarks was saying he hopes that we did have some rest, and I do think we did, but it looks like the Minister, the DG, and the Melanie Volmerans did not have any. Thanks so much for this very innovative program that is going to be added onto our reporting as of tonight. I picked up that, Minister, this information is going to be very important, and it will probably help us with even our reporters to say, in about 5,700 of admissions that we have in the country, 1,700 of those are vaccinated people, and the whole 4,000 are unvaccinated. But again, from this from the vaccinated ones, a majority of them, about 1,000, are in general wards, and very few go to the ICU, which then confirms what the Minister and the scientists actually are saying, that even if you are fully vaccinated, you may still get COVID-19 infection and get admitted, but you will probably not proceed to the ICU. I think this is a very important message that we are actually finding coming in from our country. And Professor Glenda was talking about South Africa providing the real evidence about the durability of the immunity, and then actually advising us to get vaccinated. Now, this information is very important because there's a wealth of information. December 2020 and in January 2021, the peak wave of second wave, we actually lost a significant number of South Africans and people in the world. But you then recall on the 18th of February, they started the Sisonke vaccination to our healthcare workers. And the third wave, though it actually affected us in the country, but it has a less impact to our healthcare workers. And that data is freely available from the MRC, and they can actually show that once you are vaccinated, you begin to be protected from this very wide infection. So I think that's very important reporting to assist us to spread this message. I was also picking up, Minister, I'm sure we probably remember, it was around July to be in particular, we had a positivity rate of 31%. Today we are reporting that on the, I think the 12th of December, the peak wave, fourth wave was 36.3.
It looks like the Deputy Minister is experiencing some connectivity problems. Unless it's on my side.
I thought it's my side, so it means his connection is a problem.
Yeah, he is frozen.
Frozen.
Okay.
Maybe in that case, if DG will have to step in and
I was very impressed by the contribution from Professor Groom, Dr. Michelle Groom, which says the scientists in the world are saying South Africa has been playing a very pivotal role in the world in terms of Omicron variant. Now, this is not said by the minister, politician, it's by scientists. And I hope that had in our country by the scientists supporting this government and making sure that the minister is providing a very credible scientific data and information to us. Thanks to all the members of the panelists and to our DG, Dr. Nicholas Cripps, and all those who have supported us.
Yeah. Yeah, it looks like
Yeah, no, it's not working.
Yeah.
Foster, I think you should just close.
Yeah, maybe we can just proceed. Yeah, we apologize for that technical challenge on the side of Deputy Minister. Thanks, Honorable Minister, Deputy Minister, DG, leading the departmental delegation, members of the panel, all the experts, members of the media, fellow South African for being with us during the first media briefing of the year 2022. We also want to confirm that we are going to continuously avail our leaders, our experts for any form of media queries, media interviews, so that we impart the knowledge, we empower our South Africans as far as the information around COVID-19 is concerned. On that note, I'm going to declare this media briefing adjourned. Thanks.
Thank you.